My name is Dale Mugisha. I'm an obstetrician and gynecologist from Uganda, working in Kabale Regional Referral Hospital, a public hospital in southwestern Uganda. I got to hear about Merck Foundation through a friend of mine who was working with the Ministry of Health. And so through the recommendation of the Ministry of Health of Uganda, I was able to get a scholarship to do sexual and reproductive medicine from the University of South Wales. The course content was quite good for this course. It was really helpful, very educative. It's constructive upon each other, like the foundations are properly laid in that even when you come from a background like mine where you didn't have enough exposure to some of these ART methods, sexual health and reproductive medicine training, you would still be able to pick up even when you're training with students from the first world. The platforms are pro-student and very interactive. They take into the perspective the different social cultures that we are coming from, and this course has been quite helpful. I don't know how to emphasize the value of this course. One is my diagnostic and therapeutic mindset around sexual health and reproductive issues has been quite improved. I'm more comfortable in decision making, and it kind of opens your eyes that not every fertility problem has to be treated by an IVF. There are quite many different things. The investigative ability, the capacity and power to investigate male infertility, that is commonly an issue that is rarely dealt with, and even in training it's not given that much attention. My mind is a little wider and I'm more able to offer the help to these people. We are planning to set up in the government regional hospital a day that is particularly set for infertility and sexual health. However, it's quite important from the look of it that we need to first deal with the stigma and clear the ground so that when we set up the clinic, it's more acceptable and non-judgmental. So in the meantime, what we're doing is, while we are running the clinic that is GYN, we kind of get these patients to come up and let them know that sexual health is something that they should also address, because rarely do mothers or women walk in and sexual health is a concern. They don't think it's something to be brought up before the doctor. So we know that we have to bring this one out, and this has to come as the stigma is kind of going down. I am actually trying to set up a private practice where I can be able to see how I can offer some of these services that may not be offered in the government settings. I also have a dream of where we can have some of the treatments like an IVF at a subsidized price in a government setting. However, this is something that me and some of my friends had thought we would kind of talk to through the Ministry of Health and see if we can have this arrangement. The passion for sexual health, and it looks like I was awakened to the magnitude of this problem. And the fertility issues, I feel more confident even when I'm doing the ward rounds, because as much as I work with the hospital, it's a teaching hospital. So during the lectures, I'm able and comfortably able, I must say, to pass on this new acquired knowledge to both the undergraduate students and the postgraduate students. Merck Foundation, thank you. Thank you. I'm so sure you will reap the fruit of what you're doing. You're changing the world. Thank you so much for the privilege. I can assure you many people have been helped by helping me, and I'm sure that as you help many others in the different fields, you're helping quite a number of people. Thank you for improving the health of the world, one step at a time. Thank you, Merck Foundation.